Hi, my name is Ken Cutbush. I'd like to talk to you about the risks associated with fixing a scapular fracture or a fracture of the shoulder blade. And we call it an ORIF, or an open reduction and internal fixation. So this is an example of a scapular fracture here. You can see this transverse fracture across the shoulder blade here with the big spike of bone out here. This is displaced substantially and is best fixed. This is an example of an operation that I've done. You can see two plates on that, fixing that scapular fracture and getting it back in position. Now, if we look at risks, this paper published by Karitzis et al. In the European Journal of Orthopaedic Trauma Surgery in 2024. If you'd like to look at the paper itself, scan the QR code, it will take you to it. They found the surgical site infection ran at about 0.8%, just under 1%. Wound dehiscence, problems with the wound itself coming apart, 0.4%, so something rare but something to think about. Stroke, 0.4%, transfusion, 0.4% of patients needed a blood transfusion. Pneumonia occurred in 0.4%. These are often substantial injuries with other injuries to the body, and so those are the sort of things that can happen. Unplanned return to the operating room occurred in 4% of patients, so 4 out of 100, and unplanned readmission back into hospital, 1.6%. So that's an idea of the sort of things that can happen. You always need to think about the anesthetic. There's risk from the anesthetic, DVTs, hematomas, wound issues, all of those things can happen. And I think that's a reasonable overview of potential risks associated with having a scapular fracture fixed. Thank you for listening.